My name is Brett Melnikoff, and I'm a cardiothoracic surgeon at the Chattanooga Heart Institute. I started my medical training at the Virginia Tech Carilion School of Medicine in Roanoke, Virginia, and then continued my surgical residency at the University of Alabama, Birmingham, and then completed my fellowship in cardiothoracic surgery at, again, the University of Alabama. Patients will often first meet us after they experience symptoms like chest pain. Maybe they're not feeling as energetic as they once did. It might be a little bit harder to get down to the mailbox in the morning, or perhaps they're having some leg swelling. And these are all good reasons to see your cardiologist. Some of the more common things you might see us for include coronary artery disease, valvular issues within the four valves of the heart, and a little bit less commonly, but we certainly see electrical disturbances in the heart that can lead to arrhythmias or irregular heartbeats. The Chattanooga Heart Institute is at the forefront of cardiothoracic care because we really employ a multidisciplinary team approach to include cardiologists, interventional cardiologists, imaging specialists, and cardiothoracic surgeons. With all of those teams working together, you can expect to experience the full range of treatment from the very cutting edge, minimally invasive treatments to more traditional open cardiothoracic surgery options. I have always loved to cook at home, and I have two daughters, so my favorite thing to do is to get the entire family in the kitchen and to cook together. It's just a great way to spend time at the end of the day and get everyone involved in what we're doing.